Hello. It's hard. Oh. This video, it's one thing or the other. Even now, even as I'm trying to do some recording, it's one thing or the other, you know, and it's kind of delaying the other videos that are ready, you know. And how to pull it up, it's actually a continuation of the treatment. I started, I commenced with the hormone. Now it's for me to go into surgery. And I started using this hospital, like I told you earlier. And then the consultant there actually wanted if a surgeon to come look at the case and decide what he will do, and that took time. It took a while. Until I left there, I wasn't getting back to, it was a delay. And these are the same people that told me, it's urgent, be fast about everything, Anyway, I had to look for some other place, and I found the present cancer center I'm using, and I was able to key in, and an exciting thing about that was that my result was accepted. You know how it is now in this our society. The results you bring from another hospital will not be accepted. So every hospital wants to carry out their own, investigation. But luckily for me, this was accepted. I was excited because I wouldn't have to spend more on that money, to go do all these tests. And accepting this, I had to go back to retrieve the CD, that the results were in. Because in this center, there's what is called a tumor board, that will look into this. And that tumor board consists of, specialists in the medical field, and they look into it and come up with their plan. And that plan, is expected to be used by different, hospitals that are represented there. So this, I had to do that, and I submitted it, and they sent that to the tumor board. And the tumor board, later came out with this result, with this plan, treatment plan, actually. And treatment plan for me, for my own case, was to have an excision biopsy. And this excision biopsy is going to be a wide local excision of the right breast and sentinel lymph node biopsy. In other words, basically, the right breast was going to be operated upon, and tissues were removed from the breast, and also lymph nodes were removed from on the armpit. So that's just what that surgery would involve. And after the surgery, I then go for radiotherapy. That was the plan. Went well with me. I was happy. Why was I happy? I didn't just don't want to go for chemo, because I've heard a lot about chemotherapy. I heard that chemotherapy is harsh, both short and long term side effects, and even treatments as a whole. I really, 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 really was excited about that, and that you know, made me comfortable, more comfortable, with the plan. And so, in the course of all that, I now had to, prepare for the surgery. And also, I was also advised that I should just take advantage of a surgeon that was coming into town from the US. And this surgeon, is a specialist in breast surgery, breast cancer surgery, and I was told to make myself available, and I worked towards that, made myself available to meet with the surgeon. And on her arrival, basically, I met with her. Actually, myself and my husband was following me everywhere I went. Met with him. I'm sorry, met with her. Very pleasant young lady, a Nigerian from the other states. So I was so comfortable with her. I was very comfortable. She made me comfortable. She made our discussion. We had so many discussions, both private and official. So she made it comfortable for me. I was very comfortable with her. She had to explain everything that she was going to do, what she was going to remove, from the breast, the tissues from the breast, the scar, the chest tissues, because that lump was at the border, that border of the chest and the breast, so they had to go into the chest to get some tissues out of it. And also she wanted to remove 8 lymph nodes from the armpit, and that 8 lymph nodes should be enough, for them to be able to detect if any cancer cell has left the breast area, out of it. So that was what was explained to me. I felt comfortable. I gave a go ahead. Let's go ahead and do this thing. And that was how I had the surgery. And coming out of the theater, the recovery room, and into the ward, here are my family members waiting for me. That was very exciting. That I had to feel with joy. I was very excited about that because anything could have happened. You know what it is now, operation. Anything could have happened, and I was excited. And there I was discharged, and I was like, eh. I'm just going to the theater, you're discharging me. Anyway, I was discharged, but I did go. I just appealed if I could stay one night so that I could be observed, and also my place was very far away from the hospital. So if anything like that, I can't be running back home. So I allowed to stay back, and so my family members left, and I said stayed with me. I said my in-law stayed with me, back with me, and that was how I stayed. Following day, I went back home, and then the whole the whole follow-ups were done online, where doctor had to do the do all the cleaning. I had to do it myself, and changing the dressings and all that. We had to do that online. And sincerely, it was I was excited, and I think the next video we'll talk about the experience of post surgery. Thank you very much. Thanks for listening. Bye.